OCT angiography uses the concept of motion contrast to image blood flow. This results in several systematic points of risk in terms of image quality. Simple concepts such as patient movement will certainly degrade image quality, but these are obvious. More subtle risks are the subject of this video, with a focus on projection artifacts. Projection artifacts are nearly always present in any structure that is located below the vasculature. The RPE is a simple example, but the concept equally applies to other tissue. But let's stick to the RPE for now. In this cartoon, let's pretend the RPE is the green line at the bottom of the image. As light enters the eye, denoted by the blue arrow, it passes through the tissue to the RPE and strikes a single point denoted by the asterisks. The signal returns to the eye, and the device creates a numeric representation of this area. So here now, in image 1B, representing a fraction of a second later in time, we see light entering the eye. The returning signal will obviously be identical, and then the device simply compares the numeric representation of that signal in image 1A to that in image 1B. Because there is no difference in the signal detected, there is no appearance of flow when the data is converted into an OCTA slab in this theoretical example. But in image 2A, we will have a different story. Light enters the eye, and some of it interacts with the blood cells. But in this cartoon, we are not concerned with the blood vessels. We are thinking about the RPE and the concept of projection artifacts. So stay with me. Some of the light passes through the blood cells and interacts with the RPE, but that light is altered in its signal compared to the previous image I showed you in 1A and 1B because it has to pass through the blood cells. Thus, the signal that the machine detected in the RPE is different than in the previous image because the blood cells alter the signal. I thus labeled it with a squiggly instead of an asterisk to denote the difference. And yet, at a fraction of a second later, the blood cells pass, and now image 2B shows how the RPE has a new value. This cartoon, denoting a squiggle in the RPE versus an asterisk in the RPE, is meant to demonstrate the difference in the recorded values of the RPE tissue at a specific point. Thus, the machine records this as flow. To reiterate, the motion of blood cells from image 2A creates a contrasting signal compared to image 2B, thus creating the appearance of flow in the RPE. Of course, there is also flow signal detected in the blood vessel slab, but this is real flow and not a projection artifact. Artifacts are the topic of this video, not real flow. Shown another way, here is an example of a tiny section of an OCT-B scan with flow overlay denoted by the red aspects, or more specifically, red means the machine detects flow within the structural scan. Look at the blue arrow, noting light from a tiny sliver of this section of the neurosensory retina. There are no blood vessels in this tiny sliver, and thus no flow is recorded. But now look at this tiny sliver as the light shines through an area of blood vessels. The machine correctly identifies flow in the superficial and deep plexus. But look at the RPE. It too has flow, and yet it should not. This is a projection artifact. Fortunately, most OCTA devices can use image processing tricks to remove these artifacts in the deeper layers and thus clean up the OCTA images. However, the devices are rarely perfect, and being able to recognize these artifacts is important to prevent erroneous diagnoses. Now, instead of showing you structural B scans, we are going to look at slabs, which is how we typically view OCTA data. Here, you see a slab with boundary lines going from the outer retina to the choriocapillaris. When I zoom in, you can clearly see the purple segmentation boundaries. This is a great slab to use for macular neovascularization detection and is important to get used to viewing. But the point for this discussion is that this slab does not cut through the superficial vascular plexus. Now focus on the OCTA slab. Clearly, the superficial blood vessels are visible despite the fact that the boundary lines do not include the superficial plexus. This is a projection artifact. Here, you see the same slab with the image on the left demonstrating artifacts, but the image on the right is projection resolved. That means that image processing techniques have been used by the OCTA device to remove, or at least drastically reduce, the projection artifacts. This results in a cleaner image that can now be used to look for evidence of, for example, macular neovascularization. Of course, this is a normal eye and no MNV is present. But when looking for MNV, understanding and eliminating projection artifacts is critical. So keep studying, and as always, this is Dr. David reminding you that I am always learning.